So in the past, I experienced psychotic depression, and I want to talk about this to help educate people and to help lift stigma on this often misunderstood and mischaracterized mental health condition. So there's some statistics that I want to talk to you about, some statistics about psychotic depression. So 0.4% of the general population will develop psychotic depression in their lifetime. So that means that out of all of us, out of every 1,000 people, 4 people will develop psychotic depression during their life. So it's not super low, right? That's quite a few people. Among people with major depression, 10 to 12% of women will experience psychotic symptoms at some point in time. So that's quite high, right? So about 1/10 of women with experience of depression will develop or experience some kind of psychotic symptoms. In psychiatric inpatient units, up to 40 to 50% of depressed patients show psychotic features, right? So that's a lot higher. When we look at that kind of more severe end of the spectrum, so people who need more intense support in an inpatient unit for a specified amount of time, we see that of the people hospitalized for depression, nearly half of them experience psychotic symptoms. Psychotic depression gets more common with age. So the older we get, the more vulnerable we get to psychotic depression. And a family history of mental illness, any type of mental illness, increases the likelihood of someone experiencing psychotic depression by about 70%. So that's a huge increase, right? For me, depression and other types of mental health conditions were prevalent in both my paternal as well as maternal side of the family. Up to 80% of individuals who develop psychotic depression experienced a severely stressful or traumatic event or events in the lead up, so in the year previous to them developing their psychotic depressive episode. So there also seems to be a large role for life circumstances. So it's not all genetics, but it's very likely an interaction of genetics, life circumstances, other variables that lead to the experience of a condition like psychotic depression.